Nigeria is a lower middle income group country in sub-Saharan Africa. Some of its health indicators show improvements. Life expectancy rates are increasing and under 5 mortality and maternal mortality rates are decreasing. However, its burden of communicable disease are projected to remain substantial. Nigeria's deaths of communicable maternal, perinatal, and nutritional conditions were 69.2 compared to just 21.2 for non-communicable diseases and 9.66 for injuries. Specifically, the communicable disease of HIV, tuberculosis, and malaria rank second highest among those deaths. Regarding mortality, the top three causes of death are lower respiratory infections, HIV/AIDS, and malaria. These three are also top causes of mortality in children under 5. Thus, this report will focus on the risk consequences measures for these three health issues in Nigeria.
Malaria remains highly endemic in Nigeria despite existing anti-malarial policies, with incidences rose while global incidence fell with 37%. Three risk factors contributing to its prevalence follows. First, it's vectors of female Anopheles mosquitoes breeding in stagnant, polluted water sources. Their breeding sites are common as many North Nigerians rely on hand-dug wells and contaminated ponds. Second, no vaccines exist for malaria and drug resistance is frequent while counterfeit and substandard anti-malarial drugs are common. A couple of preventive measures such as breeding substandard tetanus, and IPT for pregnant women is vital. Third, socio-economic disparities is pervasive as 68% Nigerians live on less than $1.25 US. Those of low economic status, especially children, die from malaria due to micronutrient deficiencies such as anemia. Thus, malaria needs urgent action due to its endemic status, its prevalence of breeding and drug resistance, and its causation to maternal and child mortality.
Nigeria is globally among the top three countries with highest burden of HIV, with 3.4 million people infected and 170,000 killed from AIDS in 2014. The risk factors are unsafe sex practices. Sex worker is a major source of HIV transmission because they rarely use condom and unaware of their infected status when engaging in sexual activities. Lacking sex education can lead to HIV infection. In 2012, only 24% of the younger population in Nigeria can identify correct ways of preventing HIV. Men who have sex with men is also a key affected group with 3 times higher HIV prevalence than the general population due to their unawareness of HIV infection and unprotected anal sex. Therefore, HIV needs to addressed urgently due to the high prevalence and premature deaths associated with it. Better HIV prevention methods and sex education programs could save the vast number of Nigerians from suffering in the future.
Lower respiratory infections are the top cause of death in Nigeria, with around 290,000 of deaths. Indoor air pollution, smoking, and immunocompromised people are the main causes. First, biomass and gas fuels are usually used for cooking, with poor ventilation. High concentration of indoor pollutants increases the risk of getting the infections. Second, smoking is a major cause of respiratory infections. Children that are exposed to heavy smoking could develop the infection since their young age. Third, respiratory infections are highly contagious. With HIV and malnutrition, HIV undermines carriers' immune system, and malnutrition causes people to have underdeveloped body system, so they are more susceptible to the infections. Children are even at compounded risk if their parents have smoking habits. Therefore, interventions of HIV and lower respiratory infections are urgent and should be implemented simultaneously because strengthened immune system should significantly reduce the risk of getting the infections.
Collaboration by the government ministries, communities, and international NGOs is vital to implement an encompassing action plan addressing all the above issues. First, the government must allocate funds to improve the healthcare system with more inclusive public healthcare service and education programs, such as providing vaccines and sex education talks. Second, a large-scale health promotion alongside with healthcare service could increase the coverage on spreading the importance of healthcare. Third, government has to address environmental problems and create barriers for citizens to engage in dangerous activities like enforcing laws or taxes to reduce the number of smokers. Also improve buildings ventilation, water supply and drinkage. Moreover, a surveillance system is required to monitor and evaluate the healthcare system and emergency responses. Finally, we hope the action plan can be implemented starting at the beginning of 2017 and we are looking forward to see a significant improvement by 2037.